go ahead and
All right. Hi, everybody. Welcome. I'll get it kick-started after Christina's wonderful introduction. But with that, we will kind of dive right in. Our goal is to hopefully provide a nice overview and answer some basic questions that providers may have. But then obviously, as she mentioned, feel free to chime in and unmute yourself for questions and or type in the chat, and we'll definitely take a look at those at the end. For introductions, I'm Meredith Fishbane-Gordon, just for the sake of the recording, and Dr. Majek Olaleye is my colleague who's a First Five participating provider, and Tessa Schoreder is our First Five coordinator. I'm kicking it off, and here is just a picture of how Iowa is broken down a little bit in terms of the systems of care. So hopefully this is helpful for you. As a provider, I didn't really know much of this. I've learned this through my 9 years of working with and partnering with First Five. So Iowa is broken into 15 collaborative service areas at this time. It's changed over the almost decade I've been working with the program. And so this is the most recent kind of iteration of how the service areas are broken down. And it allows for regional coordination of a lot of different services. And that includes not just First Five, but also WIC, iSmile program, the maternal and child health grants, adolescent health grants, and family planning. And so as primary care providers, we probably have some familiarity with some of those, and that's kind of nice. They're all kind of housed together regionally. Right now, First Five is supported in 88 of our 99 counties. So unfortunately, we are not yet statewide, but we're getting close, and we'll kind of go through how that process works and why that is in a little bit. But basically, the bottom line is funding. And so definitely at the American Academy of Pediatrics Iowa chapter, I have been part of a group of stakeholders who we have been advocating for this, but more voices, the better. And so definitely would love to do that advocacy and have more voices in that as primary care providers. I think that would go a long way. So I'm going to switch over to Tessa.
Hi, I'm Tessa Schoreder, and as Christina and Meredith mentioned, I'm the First Five site coordinator at Lee County Health Department. So for Lee County Health Department, we cover CSA 13, which includes Lee, Henry, Des Moines, Washington, Louisa, and Muscatine counties, along with Cedar County in CSA 14. We partner with both Trinity Muscatine Public Health and Washington County Public Health to implement that developmental support piece that we'll talk about later in our CSAs. Okay, so what is First Five? Well, we're a public-private partnership between public health agencies and primary care practices. So we support earlier detection of developmental and social emotional delays and other risk-related factors in children that are birth to 5. We also coordinate community resource referrals, intervention, and follow-up. So a little bit of background, this all started with a 3-year project that ran from 2004 through 2006. That project was the Assuring Better Child Health and Development, or ABCD2 project. And there were some lessons that we learned through that project here in Iowa. So first, we found that primary care providers are a trusted resource for parents and caregivers. We also found that standardized developmental surveillance and screening make a big difference in identifying children that are at risk early. And then finally, primary care providers needed a one-stop referral resource for children identified with concerns. So out of that 3-year project, First Five was born, and it was funded in 2007.
And what I think is really cool for primary care providers is that if you look at this timeline, this is around the time that AAP National was looking into creating the recommendations for generalized general developmental assessments and recommending those standardized screenings at 9, 18, and 30 months, and the autism-specific ones at 18 and 24 months. That was published around 2006, 2007. So it's pretty exciting to know that our state was kind of doing that in parallel at that time, same time. And really what they found is that in order to make sure that primary care providers, when doing this work, weren't kind of left floundering. Okay, now I have this new recommendation to do all of this new screening, but what do I do with these results, right? And so Iowa was ahead of the time, I think, in really trying to say, okay, well, we need to make sure that our providers have some place to refer the patients to make sure those connections to services were happening. And so that's so as Tessa mentioned, that was the ABCD2 project, looking into how that could happen. And then here, the first fiscal year 2007, where it was just implemented in a few different regions. And then slowly you can see over the years, it's expanded as the budget has allowed. The budget is put forth in the Iowa state budget. That's where it comes from. And so as that has expanded, so too, we got to 88 counties by fiscal year 17. Unfortunately, that, as we mentioned, has not been able to expand since then. But it's great in a climate where some things have been cut. This has been valued and has had level funding at least. So that's pretty exciting, but that's why there has been that kind of pause in expansion.
All right, so you may hear us talk a lot about First Five partnership. So what does that mean exactly? So what is the practice's role in that partnership? So first we ask that practices implement developmental surveillance at every well-child visit. We also ask that practices implement developmental screening per the recommendations of the AAP and the Iowa EPSDT. So that's that general developmental screening with a validated tool at 9, 18, and 30 months, and autism-specific screening at 18 and 24 months. And then finally, we ask that practices refer children birthed up to age 5 that are identified with developmental concerns like speech and hearing or social emotional concerns or any other risk-related factors that may impact that development to First Five for connections to intervention and support. So what is then First Five's role in that partnership? First of all, we provide implementation support, technical assistance, and then training on developmental screening tools. Second, we continue to provide ongoing support to our partnering practices to maintain that screening implementation sustainability. So if there's staff turnover and training is needed, or if the practice just needs a refresher, that's what First Five is here for. We're here for you to keep that sustainable for your practice. We also serve as the one-stop referral resource for practices to which children birthed to up to age 5 can be referred if they're identified with any of those concerns. And then finally, we provide follow-up to our referring providers on the status of those referrals. So referring providers can expect faxed updates periodically from their developmental support specialists who are working with the families. I think we had one slide before that one. If not, I can just go into it and talk about it. There we go. All right, so why is First Five partnership so important? So we know a few things. We know that over 90% of brain growth occurs before a child's 5th birthday. And so that's the most effective period of time for interventions and support to improve their outcomes. We also know that over 90% of Iowa children will see their primary care provider before the age of 5. So primary care providers are really in a unique position to cast the widest net for screening for delays during that period of time. We also know that the addition of developmental screening significantly increases the identification of both developmental and mental health concerns over surveillance alone. So it's a really important piece. Developmental screening is also billable in most cases, and so you can talk to your payers about that. And we also know that the availability of a one-stop referral resource that is knowledgeable and up to date on the local resources is really essential for connecting families to that intervention and support. And often our First Five developmental support specialists will identify additional needs during that developmental support process, things like social determinants of health, for which they can also connect the families to support as well. And then finally, we know that early identification and early intervention results in improved outcomes for Iowa children. All right, so here's our first five model. You may have seen this. We've got a little half sheet that's been coming around. That first five model has 4 steps to the process. The first is that the primary care provider screens how the child speaks, learns, acts, and plays. The next piece is if a concern is then identified by the provider can refer the child to First Five. The third is then the DSS, or Developmental Support Specialist, connects with the parent over the phone to discuss the concerns on the referral and to link them to intervention and support that meet the needs of their child. And they remain in contact until those services are established. And then finally, the DSS closes the loop by following up with the provider through a fax letter that shares updates on the status of the referral and any connections that were made or information that was provided to the family. So how then can a provider refer to First Five? We do have a referral form, and the one that you're seeing on your screen is the current referral form. That's what it looks like. But this form has recently been revised, so be on the lookout for that new version. It'll be coming out really soon, so you should see that coming from your First Five site coordinator soon. There are parent and provider sections to be completed on the form, so be sure to fill in your part as completely as possible, and be sure to discuss the referral with the family. And have them complete the appropriate section of the form as well and sign the release of information portion. Then that form can be faxed to your local First Five site. If you don't know your First Five site, it can be found on the Iowa HHS website, and I will try to put that link in the chat as we go along.
Sorry, I got to unmute. So the rates of First Five referrals are pretty robust. So you can see for the last 3 fiscal years right at the top. So for example, in 2022, First Five received 2,613 referrals from 700 providers. And in this past fiscal year, they received 2,247 referrals from 673 primary care providers. There's a lot of reasons for referral, but the top ones include development or behavioral concerns, which is about 40% of the referrals. Speech and hearing concerns are counted a little bit separately just for tracking purposes, and so that's about 30% of referrals. Resource needs are 10% of referrals, parent-family stress 9%, and social behavior concerns are 7%. There's another catch-all category, 7%, and if you can do quick math, this equals 103%. But as you know, it's possible, or hopefully you know, it's possible to refer to for more than one reason. So if more than one reason is identified at the visit, please mark those. And it's also really wonderful to know is that First Five really helps try to identify other needs that the family may have that may impact development. So, for example, in fiscal year 2022, of the 2,613 referrals made, 4,768 specific needs were identified as part of that intake process, and families were then referred on to those additional resources. And in fiscal year 2024, 3,477 specific needs were identified of the 2,247 referrals made. And so this is really wonderful. So as a primary care provider, we have limited time with families. And so we may realize that, oh, they, need referral and extra support for this referral noted on the developmental screen, maybe for speech, but we may not have time, or the family may not disclose food insecurity. And that's something that, is typically screened for as part of that kind of intake. So if there's other things that could help support that child's growth and development, they can help support the family make those connections to community resources, which is pretty awesome. And then this is currently First Five materials, which you may have seen before in your office. Here's an example of the trifold brochure that they have that you're welcome to share with your patients as you refer them into the program. And it's really nice. It has a whole synopsis of how the program works and kind of different reasons or different ways that they can support the family. But questions for you, and that's to kind of ponder for a moment, or you can throw comments in the chat box. But how do you share your referrals information? Do you like physical handouts like this, or do you prefer to add information into an electronic after visit summary? If you're using physical handouts, is your preferred size? Do you want it the size of a standard page, say by 11, so that you can photocopy it quickly and hand it out to families? Would you prefer something smaller, like a business card or a postcard? Definitely having that feedback is always really welcome, and you can share that with us directly, and we can share with the program, or you can email your site coordinator directly to collaborate and find the best mechanism that will work for your office. So selling points, I think, to highlight with a referral is that it's really a voluntary program. And so it's not something that's mandated in any way. It's a program that's there to serve the family and their child and really help connect them with resources. And First Five staff are the resource experts. So this is something that I, as a primary care provider, I can't keep up with all the different resources in my community. And so I think having access to First Five would be amazing in Johnson County personally. But I think that it's really a wonderful resource for those of us primary care providers that do have access. The wonderful thing is First Five connections are provided over the phone. So some families may have some hesitancy about how that connection might be made. And over the phone is a really kind of helps lower that barrier for that connection because that's a lot easier for most families to do. And then they share information with parents and caregivers about what's available in their community and help provide those connections. And they also help ensure those connections happen, because sometimes, we can think that they're going to happen and then something falls through. And so they really help follow up to make sure that connection's made, which is amazing. And then lastly, they follow up with us as primary care providers to ensure we're kept in the loop, which I think is really special, because otherwise, we just have to wait those 3 to 6 months and hope things happen. And we're constantly worried about make those connections and making sure families have that happen, and have First Five reassure us that they made it to speech therapy and they're connected. That's pretty special.
Okay, so what happens then when things don't go as planned? We know that First Five will always make at least 3 phone call attempts and 3 letter attempts to connect with the parent. That's a standard part of our process. We also will loop in the referring provider and request any additional contact information that may be available to connect with the parent. And then finally, if we're ultimately not able to connect with the parent, we will close the referral by sending a final closing letter to both the parent as well as to the referring provider. All right, and I think now Dr. Majek Olaleye is going to help and explain his role with First Five and what that impact has been on his practice for him.
Yeah, thanks. Good afternoon. Majek Olaleye is my name. I work with the University of Iowa Healthcare, and I practice in 2 of their locations, the one in Scott Boulevard and the one also in Muscatine. I've been practicing in the one at Muscatine for about almost 4 years now, and the one at Scott Boulevard primarily for almost 1 year now. So fortunately, only my patients at Muscatine are able to access First Five connection. And annually, I refer about 10 to 15 patients to First Five. And the responses that I've gotten from most of my patients has been impressive concerning First Five. And most of the ones that I refer to First Five usually have developmental challenges, the most common being speech delay. And the fact that I have to refer patients to First Five also enables me to actually screen those patients objectively for developmental delays. Sometimes when parents just come with their children, they just tell you, oh, my child is not really speaking and I don't know what is going on. And for some parents who have older children, they will tell you, oh, this child is not really speaking like the other children, so they have concern. I know that, and I asked them, okay, how many words does the child speak? Okay, they can tell you maybe at two, maybe the child is just speaking maybe 10 to 15 words. So you will know that the child is really delayed in the area of speech. I know for me to refer to first five, I need to really do the developmental screening. So as a result, I just take the pen to print out the developmental screening tool and just give it to the parent to have it filled out. So in other words, what I'm saying is that first five actually helped me to be more diligent in screening for developmental delays in some of my patients. Apart from AP recommendation that it should be done at 9 months, 18 months, and even 20, 30 months. I, I go beyond that in some of my patients that do come for work visits at other times, maybe at 6 months or 12 months, and they're having developmental challenges. So with first five, I've been able to do more than what is actually required. And what I've also found out about First Five is that they respond promptly to the referrals. From what I learned from the parents, within 48 to 72 hours, they are able to get a phone call from First Fives about the referral, and they're able to connect them with the resources around the area. And surprisingly, even some families without insurance, through First Five, they have been able to get resources for their children as well. Yeah, can you move to the next slide, please? Okay. First Five has been able to make meaningful differences in the lives of my patients and their families. Some of the things it has been able to do is that it has helped to alleviate their burdens. Like in Muscatine area where I practice, there is actually a high population of immigrants there as well. And some of them they have limited English speaking ability. And for some of their children with speech delay or developmental challenges, they're able to First Five is able to connect with them using the means of an interpreter, and they are able to connect these families to the resources in that area to help their children in terms of in to help their children with the developmental challenges that they have. And then First Five also provide caregivers access to vital social support. And then First Five also help to promote healthy child development and prevent disruptions. Like we all know, for children with developmental delays, it is always good for there to be early identification and for there to be early intervention. Because if there is early intervention, the child could eventually have catch up in the area of development. And then through First Five, we are able to promote quality early care intervention, which has been very, very helpful. Next slide, please. Okay, now is the time for us to answer some of the questions that the participant might be having and how we can help to support your practice. Yeah, thank you.
Yeah, so I didn't take a look to see if there's any comments in the chat or if there's any questions there. Not yet at this time. But curious if, let me see the participants, if there's any, in terms of the participants that are here, if there's any questions you have about the program, or if you have any ways that we can work to support your connections to your First Five site coordinator. I can stop sharing at this point. Well, actually, before I do that, I want to also, while people are thinking about questions, I want to also share this. So this is our information. So if you have any questions after this, or potentially if you're watching this as a recording, here is our information. And so if that would be helpful to connect or reach out with any of us, you may do so at a later date. And here are references as well.
Thank you so much to our panel and our presenters here. As Meredith was saying, if you have any questions, feel free to come off of mute, raise your virtual hand, or drop something in the chat. And I'll also say that I'll share the recording and contact information as well in a follow-up email. I'll wait a few moments here to see if there are questions, but I do have some questions that were kind of curated, and I'm not a pediatric primary care provider, but I do have curiosities about this program. So if there's others that do utilize the program that have questions, please let us know. If not, oh, we just have one. Beth asked, have you heard if there are any cuts in funding for First Five?
My understanding is that it's level funded, so that's wonderful. Current status is operation as usual. So unfortunately, not an increase like we had myself and my colleagues advocated for, because again, I would love it in Johnson County. But at least no funding cuts that we've heard of this year with the new budget that just came out. So that's pretty exciting.
Alongside of that, and we touched on this very briefly, what is the reason for First Five not being offered in all 99 counties? That's kind of a tough one to sum up, but if we could have any guidance so that we can advocate better.
Money. I mean, I think that's really where it comes down to. And I think that legislators know that it's important, but I don't think they understand really the great benefit it serves for our families. I think we just need more voices. So as primary care providers can speak up, I think that would be really wonderful for this great program that really supports and uplifts families to make those connections so our kids, their kids, our kids, all of the kids in Iowa can, have the best start. And the goal is to be, ready for school entry with minimal extra need for services. As we can think about this coming year, because really that in terms of, advocacy, I think that would be wonderful, because that's really the limiting factor at this point is just the budget to be able to expand further.
And if we could, thank you, Beth. That's fantastic to hear. Yes. The feedback, and again, I'm very separate from clinical care, but any feedback that I've heard regarding First Five is that the turnaround time and the services that are provided have been incredibly helpful for families. I am curious from our speakers here, if we touched on this, I do apologize. How is First Five different from early access in terms of services and referrals?
I can speak to that one. So early access is really a wonderful referral resource for us. They can address those developmental concerns for children that are up to age 3. But First Five kind of goes beyond that. So we're the connection to the resources, but we're also going to ask families about those social determinant of health type needs as well. And so we're gonna connect and maybe make those additional referrals that meet whatever additional needs the family might have as well. So it's really looking at the referral need, but also looking beyond that as well and having that conversation with the family.
And I would just emphasize too, like that connection is so huge with those extra screening processes that they do, but also early access, as Tessa mentioned, only goes up to 3, and then the services go through the school districts, which that transitions are really tricky for a lot of families. And so having somebody to help with that kind of connections between the ages of when they've graduated out of early access until 5, that's really, I think, really huge for a lot of families as well.
And when it comes to our non-English speaking families, what is the process in place to ensure that they have the same equitable access to these fantastic resources?
So when we do receive a first five referral for a family that needs, interpretive services, we do have those available to us. Some sites do have bilingual developmental support staff. But again, if we don't have that, or we have a family that needs a language other than what we might offer in-house, we do utilize interpreter services for those needs.
Fantastic. And we touched briefly on the fact that the first five referral form may change. Do we know when that may come out, and will it be accessed in the same spot on Iowa HHS website?
So the referral form won't be on the website, but it can be accessed through your site coordinator, and it will be out and be able to be utilized as of July 1st.
And we've gotten a preview, and just so you know, the new form has been really thoughtfully constructed using feedback from a variety of sources. So hopefully it'll be a lot more user-friendly for all involved and clear in terms of language, and also minimize like missed pieces. I think it's really important to highlight that as primary care providers, making sure that the parent or guardian who's there signs that permission for referral on the form. We kind of did a big box on the slides to highlight that section, and it should be clear on this new form too. But if we don't have that signed, it just makes it a lot, it can delay the process of that connection a little bit, because they need that permission to be able to connect with families. And so that's the biggest piece of our job, I think. It's not just the referral piece and telling families what to expect, but also making sure they sign that, so that transition and that warm handoff can happen as seamless as possible.
Fantastic. And for those of us in the room that do utilize the referral form process, I'm asking our audience here, what is it like for you to go through the referral process? Things that you feel are going well, or other spots that may need adjustments? We would like to know and see if we can answer any questions.
I think for me, at times, seeing a patient who has come for well visit, and in the process of the visit, I discover has developmental challenges, and then I now decide to screen using any of the developmental screening tools, ASQ3 or ASQ and E. And after they have filled it and I'll go through it, it could be a little bit cumbersome and could make the visit very prolonged. And then to now add to it, okay, and I decided that, okay, this child needs referral to first five connection. Then for them to fill the form, sign it, it could take a while. Like, I think they have like 2 or 3 places to sign. If it's possible to limit it to one, I think that might be helpful. The good thing is that I don't feel every aspect of it. Once they have done their part, I collect the form from them. I give it to an office staff who will just help to fill in the other information. So I think if we can limit the part that they have to sign to 1 or 2, I think that might be better.
I think you'll be happy to hear that that new form addresses that very concern. So,
Okay.
yeah, I believe on the new form, it asks for one signature on the form. So,
Okay.
yeah, that's exciting, isn't it?
Thank you about that.
Does anyone else have any questions or anything to share?
Yeah, maybe one request I can make is if you can make some of the first 5 brochure available to some of the providers so that we can just also share that with the family, I think that'll be helpful.
I'll be sure to drop some off for you.
Thank you.
You're welcome.
Tessa, is that something that I could share with the group as a PDF form as well?
I would have to check with our state consultant, but I can certainly find out.
Fantastic. Okay, I will ask one more time. Any other questions, comments, or concerns for the group? Okay, I'm going to go ahead and stop the recording here.